All right, so if you have to have major surgery, wouldn't it be better to do it with only one incision and cut your recovery time in half?
Oh my God, thanks to the advancements in single-site surgery, now you can.
Yeah, right at Windham Hospital, they're able to help women recover from surgery faster without scarring and get back to your life.
Take a look.
I had a complex cyst on one of my ovaries, and so the doctor removed that, and it had to be sent out for pathology, and when that came back, it was showing a risk of turning into something.
Lori Bender decided to have a hysterectomy to avoid cancer in the future. Dr. Robert Gildersleeve, an OB-GYN with Windham Hospital, said he could do the surgery with only one incision in her belly button.
Was it easier for you to take that next step when you found out how the surgery would be done?
Oh, absolutely, because I'm self-employed, and the first thing that came to my mind is how am I going to take all that time off from work? And I'm a hairdresser, so I have this clientele that, you know, I have to try to juggle around.
So compared to women are familiar with what it's like to recover from a C-section, this is a lot less.
Yeah, considerably less. I mean, the incision is typically what hurts the most after a hysterectomy or a C-section or something like that. You don't get pain so much from the internal organs or the recovering scar inside. Most times it tends to be abdominal wall pain. So the minimal effect on the abdominal wall, the minimal effect on pain, and you maximize recovery.
Most patients can be back to normal life after 2 to 3 weeks, instead of the 6 to 8 with the old kind of surgeries. With the single-site laparoscopic surgery, doctors can do many procedures.
Anything that's ovarian related, ovarian cysts, you know, tubals I've done through single-site surgery. I have done hysterectomies through single-site surgery. This is the ring that goes inside, so I initially will create an incision that's probably about the size of the belly button.
Patients are left with only one incision to heal from and no visible scars.
And how was the recovery for you?
It was amazing. I mean, I felt, you know, other than being tired, I bounced back really quickly. You know, I got back to work after 2 weeks. I was out in the garden, you know. It was really, really easy on my body.
Lori says she even felt like she could have done sit-ups after only 5 days, but she didn't break the rules. Angelina Jolie's decision to voluntarily get a double mastectomy and hysterectomy after discovering she has the cancer-causing BRCA1 gene made big news. Doctors here at Windham Hospital say this single-site surgery can help local women who are faced with the same choices.
If you're one of those people that has the BRCA1 gene, is this type procedure good for you?
It's an excellent choice, and I actually had a patient who was BRCA1 positive and opted to have her ovaries removed as well, and it worked great.
Lori's feeling great now and back to work and yoga again, and she loves that she can't even tell she had surgery when she looks in the mirror.
If you're still into wearing bikinis, not that I am, but you know, it's certainly for a younger girl or someone that's really in shape, if that's a real concern for them having scars, you won't have a scar.
Wow, that's an incredible operation, and that is an incredibly in shape and attractive woman. I don't know what she's talking about.
She should wear a bikini for sure if she wanted to. But Lori also says she loved that she could have her surgery right at Windham Hospital, much closer to where she lives. And she says the doctors and nurses were nothing short of amazing. So if you had to go through something like that, she says, you know, all in all, she just felt great. She said she's had way worse experiences before. This was rather easy.
Single-site surgery, that's what it's called.
Single-site surgery or single-site laparoscopic surgery. But for more information, you can go check them out at our website, betterct.com.